Welcome to another episode from the Veterinary Research Channel. Today, we're diving into a fascinating case study that highlights the challenges and innovative approaches in managing hookworm infections in dogs, specifically focusing on the emergence of drug resistance. This case, documented in the Journal of the American Animal Hospital Association, showcases the use of a novel molecular technique to diagnose and manage a persistent hookworm infection in a greyhound. Imagine a 4-year-old greyhound, a former racer, now enjoying a more relaxed life with a new owner. But this dog starts experiencing chronic intermittent diarrhea that lasts for more than 3 weeks. The owner takes him to the vet, and initial fecal analysis reveals an infection with Ancylostoma caninum, the most common gastrointestinal nematode in dogs in the United States. So, the vet prescribes routine anthelmintics, standard treatments designed to eliminate the hookworms. These medications usually belong to one of 3 classes: benzimidazoles, tetrahydropyrimidines, or macrocyclic lactones. But despite repeated treatments, the diarrhea persists, and the dog continues to test positive for caninum. This is where the mystery begins. Why isn't the treatment working? Treatment failures can occur for several reasons. It could be due to larval leakage, where dormant larvae in the dog's tissues reactivate and reinfect the gut. Another possibility is environmental reinfection, if the dog is constantly exposed to contaminated environments. Sometimes, lab tests can give false positives, or the infection might be caused by spurious fecal parasites. But in this case, the culprit was something more concerning: true drug-resistant hookworm infection. To get to the bottom of this, the veterinarians turned to a novel fecal gastrointestinal real-time polymerase chain reaction, or qPCR, parasite panel. This advanced molecular test can detect 20 different gastrointestinal parasites and, crucially, identify markers for benzimidazole resistance in hookworms, as well as zoonotic giardia. It's a significant advancement because, in the past, traditional methods or older polymerase chain reaction techniques were either unavailable or too expensive to be a practical option. The qPCR panel is relatively inexpensive, has a short turnaround time, and only requires a small fecal sample. The qPCR results were revealing. The dog was indeed infected with caninum, and the hookworms carried the genetic benzimidazole resistance marker F167Y. This marker indicates that the hookworms are resistant to benzimidazole anthelmintics, a commonly used class of dewormers. This explained why the initial treatments with Fenbendazole, a type of benzimidazole, had failed. With this new information, the veterinarians changed their approach. They prescribed imidazole, a drug not typically used in dogs in the United States. Imidazole belongs to a different class of anthelmintics called cyclooctadiene. It works differently than the standard drugs, binding to a different receptor in the nematode's nervous system. This different mechanism of action makes it effective against many nematodes, including those resistant to other drugs. The greyhound received imidazole, and his clinical signs, including the chronic diarrhea, resolved. Follow-up qPCR testing confirmed that the caninum infection and the benzimidazole resistance marker were no longer detectable. To ensure the infection was completely eradicated, the dog continued treatment for 6 months, with regular monitoring using the qPCR panel. But 5 months later, a routine retest revealed a twist. Caninum and the benzimidazole resistance marker were back. Even more, the dog was also infected with giardia. However, the dog was not showing any clinical signs. The veterinary team suspected environmental reinfection. Despite the owner's best efforts to clean up, the dog's yard was likely contaminated with hookworm larvae and giardia cysts. Because the dog was not showing clinical signs, the team continued with the imidazole treatment. Subsequent tests came back negative, and the dog remained healthy. This case illustrates several important points. First, it highlights the growing problem of anthelmintic resistance in hookworms. The widespread use of deworming medications has inadvertently selected for resistant parasites, making infections harder to treat. Second, it demonstrates the value of advanced diagnostic tools like qPCR. Traditional fecal exams can miss infections or fail to detect drug resistance. Molecular tests like qPCR offer greater sensitivity and specificity, allowing veterinarians to identify the specific parasites involved and any resistance markers present. Third, the case underscores the importance of a comprehensive approach to managing parasitic infections. This includes not only appropriate drug selection but also environmental management to minimize reinfection. It also requires a thorough clinical history, as well as a stepwise approach to clinical management. What are the broader implications of this case? The rise of drug-resistant hookworms poses a significant challenge to veterinary medicine. Veterinarians need to be aware of this issue and use diagnostic tools and treatment strategies judiciously. Indiscriminate use of anthelmintics can worsen resistance. Furthermore, hookworm infections have zoonotic potential, meaning they can be transmitted from animals to humans. In humans, hookworm infections can cause cutaneous larval migrans and eosinophilic enteritis. By accurately diagnosing and treating drug-resistant hookworm infections in dogs, we can reduce the risk of human exposure and promote public health. This case also highlights the importance of the One Health initiative, which recognizes the interconnectedness of human, animal, and environmental health. By addressing drug resistance in hookworms, we protect not only our pets but also ourselves and the environment. The detection of the benzimidazole resistance marker ruled out larval leakage as a cause for the persistent infection. The Keyscreen GI parasite PCR panel result also detected concurrent infection with a Giardia assemblage exhibiting zoonotic potential, which further supports the suspicion of environmental reinfection versus larval leak as the cause. In conclusion, this case of a greyhound with a persistent, drug-resistant hookworm infection demonstrates the power of modern diagnostics and the importance of a comprehensive approach to parasite management. As drug resistance becomes increasingly prevalent, veterinarians must stay informed and utilize advanced tools to provide the best possible care for their patients and protect public health. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.